This is From Both Sides, a spontaneous, free-flowing conversation featuring a dynamic team of women, providing insights into both political and civic events affecting the lives of women throughout Pennsylvania. And now, here's your host.
Hello, and welcome to another edition of From Both Sides. I'm Michele Sellitto, your host, and today we'll be discussing one of the leading problems in this country, childhood obesity. 1 out of every 3 children is either overweight or obese, and this problem has doubled in the last 30 years. Today we're not only going to be talking about the problem, but we're going to be looking at solutions by talking with the officials of an innovative program that explores active lifestyles, healthy eating, and wellness strategies. Joining me today is my guest co-host, Jeanne Arnold. Jeanne is a well-known civic leader, philanthropist, and medical professional herself. And I know, Jeanne, that this childhood overweight and obesity is very dear to your heart.
Yes, it is, Michelle. I am on the National Board of the Boy Scouts of America, and Dr. Robert Gates, who's our retired Secretary of Defense, who now is the volunteer president, has asked me to lead a task force for the Boy Scouts, not only nationally but internationally, on the prevention of childhood obesity.
Wow, that's exciting.
It is.
That's
It is.
exciting.
It's a big
So-
job, but I'm very anxious to see what we can do about this.
Great, and so we'll see what this plays in terms of your larger agenda
Absolutely.
in the international scene. Okay, great. Well, let me introduce our guest today. It's my pleasure to introduce Dr. Jennifer Krasniewski. Jennifer is the Assistant Professor of Medicine and Public Health Sciences and the Executive Director of the Penn State Hershey Pro Wellness Center. We're going to be talking about the Pro Wellness Center with you today, as well as your colleague Donna Gephardt, who is the Director of Outreach at the Penn State Hershey Pro Wellness Center. So welcome to both of you for this very important issue.
Thank you.
Glad to have you here. Maybe we could start off by telling the viewers about the scope of the obesity problem in this country. Jen?
We were just so thrilled to have you invite us to speak today because this is such an incredible public health problem. Obesity really is an epidemic in this country, and currently 2 out of 3 adults suffers from either being overweight or being obese. In fact, in some ways, obesity is the new smoking. Looking at it as preventable causes of death, obesity falls right behind tobacco use as the second most preventable cause, which is just incredible in terms of the impact we could have if we could address this epidemic.
Mm-hmm. Well, you know, it seems to me, as I was thinking about this issue, like from a personal perspective, I gained weight twice in my life. One was when I went off to college. I had that freshman weight gain, and one was once I hit my 50s, Jeanne.
Oh.
I used to be able to drop 10 pounds like that. It's more challenging now. So are there certain periods of time, other than my times, that people have to be aware of this, are prone to gaining weight?
It's interesting that you bring up those 2 times because I think they're very common, and a third that I would add to that is during child rearing, so women who gain weight during pregnancy. And there are certainly times like that throughout, from childhood through adulthood, that we are more prone to gain weight, but unfortunately you can gain increased weight at really any time point.
Mm-hmm, mm-hmm. Well, is this just an adult problem? Or where do you see most of the impact of this weight gain and obesity?
Unfortunately, it's not just an adult problem anymore. It affects children, and you mentioned the statistic of 1 in 3 children being affected by this. Kids who grow up with an obese parent have a 40% increased chance of being obese themselves.
Wow.
And if both of their parents are obese, that doubles to 80%. And unfortunately and sadly, our youngest generation is expected to live shorter lives than their parents. And this is the first time that we've had to say that. The obesity epidemic is threatening to undo all of the major medical advances we've made over the last several decades.
And Jeanne, are you finding this internationally too as you begin to put all of these issues together? Not only our country, but are we kind of ahead of other countries in terms of the obesity issue?
I believe we are. I really do. I mean, I think there are other countries that have the same issue, but this is a big, big problem in our country. And just in going around and trying to research what is going on, I'm finding that many organizations, including Pro Wellness, they're trying to see what they can do about this.
Okay. All right. Are there, what's the difference, if you could tell our viewers, between being overweight and being obese?
So there is an actual definition. We usually use a term called body mass index, otherwise known as BMI. This is typically used as a screening tool, so individuals shouldn't use this as a diagnosis themselves. They should certainly talk to their doctor. But in general, a body mass index, which is a formula of height and weight, is calculated between 18.5 to 25 for what we consider a healthy weight. And I use healthy now instead of normal because really the normal is no longer the healthy BMI. And then between 25 and 30 is considered overweight, and then greater than 30 and going into different degrees is considered obese.
Do people know how to calculate that themselves?
It's a complicated formula, otherwise I would give it over right now, but certainly there's plenty of websites, including our own, which has a really easy to use calculator and a demonstration of how to do this. So it just takes for knowing your height and your weight in order to come up with a number.
Well, one of the things that I wonder about is when you say that children whose parents are obese tend to be obese. How do you is that just lifestyle, do you think? Is it inactivity? What is causing our population to become bigger and more obese? What are the factors in society or the things that we eat that are causing this gradual kind of heavier weight in terms of society?
That's a great question. It's actually a combination of many different factors. We say that we have a very obesogenic environment, which is a big fancy term to say that there's a lot of things in what we do and see every day that increase our risk. One of my favorite terms is actually obesity is contagious. So there was a study that was done looking at individuals, and they followed over this cohort of individuals over 30 years to see how their body mass index changed. And what they found is we are more likely to have our BMI resemble our coworkers than our own spouses or our neighbors or even our siblings. So although there definitely is a genetic component, there's certainly the nurturing of our environment that is playing a larger role.
So what was the implication of what you said? The place where you find yourself to be most of the time is how you're going to tend to eat. So if you're eating at work or whatever the eating habits are at work, they can tend to be replicated?
Absolutely. Adults spend most of their waking hours at work, so it shouldn't come as too much of a surprise to us if this is where they're most likely to pick up similar habits.
Jennifer, don't you think too that when we wear these more comfortable clothes that give us an opportunity to again, be more comfortable, less binding, that makes a difference too?
Well, I won't comment on my outfit today as being more comfortable, but certainly I think figuring out ways that you can work physical activity into your daily routine at work is a fabulous idea. One of the things I like that we use at work is walk and talk meetings. So particularly if you're just meeting with one or two other individuals, use that hour instead of sitting in a conference room across from each other to be active and get your step count in.
And wear less elastic.
Yeah, that's right. I know, I'm wearing these leggings all the time, and I'm finding that, I have to stop that because that just emphasizes more comfort versus really, working on my issues about getting steps in.
And keeping your waist where it was when your jeans fit comfortably, right?
Yeah, right.
But we're really a more sedentary society, don't you think, than even, I don't know, 50 years ago, 100 years ago. People seem to kind of do more physical activity. I know in my own situation, hire somebody to do the yard work, or some of the yard work, at least the mowing. And things that I think, if I look at my parents, they took for granted that they do themselves compared to what I do in my home and the kinds of things I do around the house.
I think it goes beyond just examples like that where you're making choices about activity or inactivity. I don't think our world makes it very easy to do a lot of things in a healthful way. So unhealthy food and beverages are very available. Opportunities to drive really close to where you're going and not walk are very available.
The portions that we get when we go out to eat, I know that with the Boy Scouts, we actually were at the International Jamboree last summer in Japan, and eating there, the portions were much less than what we see in this country, and that's an issue too.
My favorite story from my mom, growing up, she worked at McDonald's while she was in college. And what we currently have in the Happy Meals for our children was considered an adult size for fries. And that's just one small example of the way portions have grown out of control, making it more difficult for people to do the things they need to in order to watch their weight.
Are certain segments of society, though, more prone to be overweight? Because if you just look at the cost of healthy food compared to the cost of fast food, I think there's a difference there. So do you find that in your research?
Absolutely. Unfortunately, our most vulnerable populations are at increased risk for having higher rates of obesity. So ethnic and racial minorities and people with lower socioeconomic status have an increased risk of being obese. And unfortunately, that carries with it all of the complications.
Well, what are some of the things that you are doing at the Pro Wellness Center at Penn State Hershey to combat some of these really terrible issues that our society is dealing with now in terms of weight?
We spend most of our time looking at trying to inspire people to be health champions, whether they be people who work within a school or people who run a household, or people who have influence in their community through their church or other civic organizations. We try to provide tools and resources, mostly through our website, for people who would approach us from the general public. We provide recipes, we provide, as Jen mentioned, the BMI calculator, other strategies and helpful tips for them to be able to make change. I think it's so hard to know where to start. I think our biggest struggle is to try to find people who are ready to make change. Once people are ready to make change, that's where it's really crucial to offer them the tools and resources they need. And so we try to make sure that we're meeting people at multiple levels and from multiple backgrounds through our materials and resources.
Well, I really think that's a really good point, especially someone who is more overweight, more maybe obese than overweight. What should, from a medical perspective, be the first thing that someone does? Should they see their doctor to begin?
Your doctor can certainly serve as a great partner in your weight loss journey, and in fact, that's a great place for most people to start. Unfortunately, and our research shows that primary care doctors are providing less and less weight counseling. Over the last decade, we actually are providing about half as much weight counseling as we did 10 years ago, and this is in light of the obesity epidemic really just taking off. So despite that being a great place to start, it's actually not happening in the clinic setting. But I would encourage people to be open to talking to their primary care doctor as a first step on what might be right for them.
The other thing I think that I know when I want to lose a little bit of weight, I increase my physical activity. I just think that's a simple way to look at something and say, I need to start walking more, or I need to go to the gym more. So anything like that to really get my system to burn more calories. Okay, well, it's been a great discussion so far. Let's take a moment and we'll hear from our sponsors.
From Both Sides is a production of the Susquehanna Valley Center for Public Policy and is made possible by the support of the Pennsylvania Center for Women and Politics at Chatham University, a nonpartisan center devoted to fostering women's public leadership through education, empowerment, and action. The first to focus on women's political involvement in Pennsylvania, the center integrates disciplinary knowledge, civic education, and capacity building, while examining the intersection of women and public policy. From Both Sides is also supported as a public service by Saul Ewing LLP, a law firm with a 100-year tradition of serving the needs of business, government, education, healthcare, technology, and manufacturing in our region. And by the University Center for International Studies, the engine for extending the global reach of the University of Pittsburgh and its students. From Both Sides is also sponsored by Dr. Wendell Funk, one of Central Pennsylvania's most experienced cosmetic plastic surgeons. Dr. Funk is a leader in new and innovative non-invasive procedures like cool sculpting. His long-term experience with all types of cosmetic surgery, as well as facial injectables, keeps new and repeat patients returning to his practice in Lancaster, York, and Camp Hill. From Both Sides is also sponsored by the Ed and Jeanne Arnold Foundation.
Welcome back to From Both Sides. We're talking today about a leading health problem in our country, childhood obesity. joining me, my co-host Jeanne Arnold. Jeanne, why don't we start by having you talk a little bit about your connection with the Penn State Hershey Pro Wellness Center and your work with the National Boy Scouts.
I'd be glad to. Well, I want to go back a little bit to a project that started about 4 years ago, and I'm on the board of the community advisory at the Hershey Medical Center. And now through the IRS, to maintain your tax exempt status, you have to show that you're doing work in the community that's making a difference, that there are some outcomes from it. And so I was able to introduce the nurses from Penn State Hershey to the Lebanon School District nurses, where they're covering 7 schools. And from that, it was decided that how they could help would be for Hershey nurses to go into the Lebanon school districts and do all the screenings. And that project has been so beneficial because the screenings are done in 2 days, and Pro Wellness was a real part of this.
And what kind of screenings would those be?
Oh, it would be, it depends on what the grade is of the students. 1 year it may be a vision, the next year it might be hearing, depending on where you are, height and weight. But it was taken, the nurses would go through maybe a whole year and not be able to do all the screenings. We're talking about over 5,000 students in those districts. So the Hershey Med Center just stepped up. The first screening, they sent 90 nurses into Lebanon, and it was done in 2 days. Pro Wellness then has taken a lot of that data and those statistics, and actually, I'm sure they'll talk about what has happened on a statewide based on that. But then in my working with the Boy Scouts, I've been going around to a lot of social service agencies in the Lebanon, Lancaster, and Harrisburg community to find out, what are you doing? What is going on as far as wellness and prevention of obesity? And through that, and particularly with the Hershey Med Center, which I got a lot of connections and very fond of, met Jennifer and Donna, and they've just they're green light people, and they're like, how can we help you? They ran with it. And now, I'm so excited because they've actually put together a possible program and pilots, how we can approach this.
Okay, so trying to tackle the problem by connecting with the schools and getting to the children first. Yes?
Right. If I could just elaborate a little bit, Pro Wellness is actually the Pro, and Pro Wellness is an acronym for Prevention, Research, and Outreach. So our role in the screenings that happen at Lebanon School District were part of a research project where we were trying to evaluate and improve the statewide screening letter where height and weight are reported to parents. So every child in public schools in Pennsylvania has to be screened for those health outcomes: hearing, vision, height, weight, scoliosis around 6th grade. And the letter that was being distributed to parents wasn't quite as informative or helpful as what we envisioned it to be. So we set out to evaluate the letter and to improve it. We actually developed a letter that has now been adopted by the Pennsylvania Department of Health as the recommended letter statewide. And then we found out recently that the Centers for Disease Control has actually recommended our letter. It's one of 3 options for letters. So it's actually available nationally, which is really exciting.
So we're setting the trend here in central Pennsylvania
Yeah.
for the national efforts. That's fantastic.
Right. Penn State Pro Wellness Center, because of its affiliation with an academic medical center, is committed to promoting only evidence-based strategies. And so when Jeanne came to us with her idea about what to develop for the Boy Scouts, that was really where our team came together to develop this plan. So it is a 3-arm pilot, and it's looking at interventions that have demonstrated success in various platforms, and we're trying to evaluate them in the Boy Scout community to see which one will help them, because this organization is committed to preventing obesity in the future for the Scouts.
So you're focused, though, on children. Is that correct?
That's right. Our reach is in, currently we're in a little over 700 schools in the state of Pennsylvania.
Okay, and what does that mean, Donna, what does it mean to be in 700 schools? What is the relationship? And if someone's watching who, I'm a former school administrator, if someone's watching who would like to get their school involved, what do they do, and what does that mean that you're in those schools?
That's a great question. So in some cases it's deep, and in some cases it's broad. So from the O in Pro Wellness Outreach, we have a Healthy Champions program that any school in Pennsylvania has the opportunity to sign up for. They receive our tools and resources, access to materials on our website, and information around 4 signature events. And it's really more of a social marketing campaign. So we have 2 programs that talk about moving, so walk to school day and get outside.
And get kids moving.
That's right, and all the resources and maybe curriculum for the week surrounding those activities to help school officials come up with ideas for how to get kids moving. And then we have 2 around eating. So Apple Crunch and Go for the Greens. Go for the Greens is actually celebrated March 17, so it's coming up, and where we promote whatever that might be. A lot of schools seem to do broccoli, but to introduce kids to other vegetables. We have stories of, recently a school was telling us about the introduction of kale for the day of, believe it or not, of Go for the Greens, and how many kids had never tried kale, they didn't have a good idea about kale, and how much they enjoyed the samples that were provided to them. So that's more of a broad example of how we're into schools. But we're also supported by foundations and places like the Pennsylvania Department of Health to do much more deep work. And that includes schools getting grants from those organizations, and we help manage those projects through technical assistance and project management for how to do sustainable changes around healthy eating and active living in those schools.
Is there any research, Jen, if students are exposed to these kinds of better eating and healthier lifestyles, that they take that home and impact their parents?
That's a great question. Unfortunately, kind of the obesity prevention research is, I would say, in its infancy. So we don't have a lot of great evidence yet on how to prevent obesity. You know, up until maybe 30 years ago, actually the goal with school food programs was to make sure kids had enough to eat. And so it's only in the very recent past here and moving forward that we need to focus the other direction, that there's actually too much intake, and how do we make that healthier. So not yet, but we're working on it.
You know, one of the other problems that I find is when I go out for dinner or lunch, not all places list the calories of the, my cousin and I were out the other night. I was going to order Brussels sprouts because I really like them, and they had some kind of caramelized sauce on them, and they were like 600 calories.
Caramel.
Now, who would have thought that something like Brussels sprouts would be? So it's a really tricky situation, and if people don't list the calorie intake, I personally think that's something you should advocate for, Jeannie. I think that the calories should be required to be listed on every menu in Pennsylvania.
Absolutely, absolutely.
Because I think it really helps people. I used to love those scones at Starbucks, but now when I know that they're 450 calories,
It took all the fun out of it,
yeah,
didn't it?
it really did.
It does.
It
It does. No, you have to know. You have to know what that is, and then make better choices. One of the other things that I'm finding too, I was at a meeting yesterday of the Lebanon Community Health Council, and some of it is, if you have these foods, how do you cook them? So part of how do you prepare a meal? Because many people in these underserved areas don't know how to cook. And then what makes it more flavorful? And so part of, I think, of our project will be to have kitchens that will bring children in and teach them how to cook. What are good menus? There's a lot of that going on now, particularly in Lebanon.
It sounds like there's a lot of programs out there, and I don't know, how do we bring this all together for people to really have a complete understanding of the things that are available?
Well, that's what I'm trying to do. And yesterday with the meeting at the Lebanon Community Health Council, after I left that, I gave my email, and I got all kinds of responses from different organizations that really want to work on this. They are forming a committee that will take this on as a project. And of course, I would want Jennifer and Donna involved in this to help so that they can do some of the research and what program really impacted the children and the families. Because once you start to teach the children and that gets to the parents, that may have an impact on the adults. And that's really, I mean, this is a whole, it is irrespective of age, and ethnicity, it is a big problem that we have. And the bottom line is it's going to affect your health sooner or later, whether it's diabetes, cardiovascular disease, just name it. It is really an issue.
Are there any incentives to adults, whether it's through your insurance programs or to be healthier and to maintain your weight?
I think some insurance companies offer nutrition counseling or help with like subsidizing gym memberships or participation in a program, for example, like Weight Watchers. We're seeing a lot of employers who are more and more interested in trying to promote health and wellness among their employees.
Because doesn't it really, in fact, cost more if someone is overweight or obese
Absolutely.
to maintain their medical care?
Absolutely, it does.
So this should be an incentive for employers to offer, or this should be information for employers to offer incentives to their employees to try to maintain their weight and health.
And not only does it help them to improve their health, but it also makes them a more motivated and committed workplace. So
productive?
that's right.
Absolutely more
Productivity,
productive.
engagement, several factors that make them a better employee. And then they get the added benefit of feeling better. So, you know, it's sometimes you can't convince them until they've experienced that, but that's definitely
I know
another
the
outcome.
national office of the Boy Scouts in Dallas. I mean, they're all in competition with Fitbits and their apps on their phone to see how many steps they're taking every day. These are things that are fun, and when you look at it, I mean, sometimes I'm amazed at how many steps I have taken, but there's other days I'm thinking, oh my God, I'm only like 400 steps today. What am I going to do about that?
Yeah,
you
it's
know?
great to manage it, and so you can
right.
really pace yourself.
Right.
Well, if you had to give some kind of advice to some of the groups that have been affected by this weight problem, kind of like one piece of advice, if you could tell, say, let's say a young boy or a girl who is overweight and concerned about it, what is one thing that a young child could do to start to get themselves on the right path?
I think a young child needs to find a partner because no one can start this journey on their own. But just getting started, I think, is the first step in the right direction to being healthy.
Okay, and how about a piece of advice, say, for a college student, someone in college, because that's a different lifestyle and a different.
Before you said college student, I had a thought in mind, but now it's really applicable to a college student, and that's be mindful of the calories in your beverages. And I think that one of the things that's really hard for people to understand, you gave the example of scones. These sugar-sweetened coffees are in a lot of cases as many calories as a milkshake, and so many of us would not think of having a milkshake every day or twice a day,
Right.
but that's a big
soda
trend.
as well.
Soda,
That's right.
yes.
Okay, all right. Well, there was such great information today. You were a terrific guest. Thank you so much. I feel like there's more to talk about on this.
I think we
issue,
should.
Jeannie.
Yeah,
So I really
absolutely.
think we're going to have to come back and talk with you again. Thank you for joining us. I'd like to thank the viewers for joining us, and I'd like to close by saying, despite the political differences women have in Pennsylvania, there's much more that unites us than divides us. So I hope you'll join us again for another edition of From Both Sides. Thank you.